Hi, this is Joe. I am coming off of my second injection for the trial drug that is going to hopefully make my nerves grow back for my spinal cord injury. And this is being done by Mass General and Spaulding Rehab in Charlestown, Massachusetts. There is a 50-50 chance that I will either get the medicine or a placebo. It's a double-blind study, so I really don't know what I've received these last two injections. So I'm getting these injections through a lumbar puncture, which also means that I'm getting a spinal tap where they remove roughly 4 vials of my spinal cord fluid, and they replace it with either the placebo or the drug. I don't know, again, which is which, so I don't want to be overly optimistic. So I'm kind of going into this cautiously optimistic. So it is supposed to help regrow the nerves, and there's a lot of hope in the industry that this will actually work. This is the second clinical trial. The first clinical trial on humans had really good results, and we are hoping that they'll have similar, if not better, results for the phase 2 clinical trial. And this clinical trial will last roughly 8 months, so it's a big commitment. I'm going in roughly once a month to the hospital. I get tested. They're doing ASIA exams for each visit, and then the next day I am receiving the injection, and I do have to stay overnight because I have to be observed just to make sure that nothing funky is going on if I do have some sort of a reaction. So far I have not had any real negative reactions. There are some minor side effects, but that's to be expected. Anytime that you get a lumbar puncture, there are some things that you need to be made aware of. People have asked me if the lumbar puncture hurts. So for some people it does. I happen to have a feeling from head to toe. It varies though. So does the nerve pain. And for me, I do feel things going into my skin, which sometimes causes me to have some minor spasms. And then unfortunately I do feel the needle, but the first go around I had no pain at all. Second go around, a little bit more pain, but everything went well. Got an amazing surgeon who's actually doing the lumbar punctures, and he's heading up this study. So people have asked, have I felt different after getting the 2 injections? And again, cautiously optimistic. The cautious part is, I know it's a 50-50 double-blind placebo study, so I could just be getting saline. So I don't want to be too optimistic about it, but the optimistic side of me says that fingers crossed, I hope I get it. Even if I don't, I just hope that this research helps somebody down the road who has a spinal cord injury, where this can help them regain some of their function back. So if you go and you do some research on this drug, they do make claims for what they're trying to do. And what I can tell you so far, and this is the optimistic part of me, we have had measurable gains in many of the areas that the drug is supposed to help. Not everything, but definitely certain categories. We have tested from one injection to the next, or one dose to the next. The things that they measure me for, we've seen some pretty positive results. So several months from now, if I find out that I get the placebo, I'll just have to laugh and say, hey, give me more of that placebo because it's working. Honesty and sincerity, I do hope that I am getting the drug and that it is working, and that it will help people with some of these things that the drug claims that it's going to fix. So I have roughly 4 more doses to go, and then the last visit will be just a spinal tap. So I will be keeping people posted on how I'm doing, and whatever I'm allowed to say in terms of any benefit that I'm getting from the drug, I will go ahead and do that. I don't want to get too specific on things because I don't want to bias people and affect the outcomes of either this clinical trial or the next clinical trial. But once everything is put out there in the public domain, that should give me a little bit more room to get into the specifics for what's going on.